Hi, my name is Marla Neufeld, and welcome to the Surrogacy Space. Today, I'm joined by the very esteemed and accomplished reproductive endocrinologist. His name is Dr. Jonah Bardos with White Glove Fertility. So, Dr. Bardos, thank you so much for taking your time today to be on the show.
Absolutely. It's a pleasure to be here.
Yeah, I had the great pleasure of meeting Dr. Bardos at a Jewish Fertility Foundation event, and I learned a little bit more about his practice. And I thought it would just be a great resource for people that listen to the show to understand about white glove fertility and how they help. And so I'm going to pass the torch over to you if you just want to let us know about white glove fertility and a little bit about your practice. That'd be great.
Sure. Yeah, absolutely. So our practice was, White Glove Fertility was basically built around the idea that fertility care should really be personal again. So we're a concierge-style practice, and what that means is that we really help guide patients more individually, whether it's through IVF, egg freezing, donor conception, gestational carrier, surrogacy, and that includes a pretty high level of access and communication. And I would say one of the biggest differences is that here you're not a number, right? So patients are not just a number in a large system, but they have that direct access to the doctor, rapid communication, and individualized treatment plans. And that was basically that, I would say, is the us in a nutshell.
Yeah, I love that. I mean, the name really sums it up. And for
Exactly.
myself, like having gone through infertility and IVF and surrogacy, I mean, improving communication eliminates so much stress. I mean, that is for sure. So I'm sure your patients really do appreciate that concierge service.
Yeah, I can tell you the 9 p.m. text messages. So
Oh,
we have like a text message system. So you can, if a patient has a question at night after hours, they can text and someone will
that's
typically
unheard
respond.
of. I mean, that's like amazing because I
All
know
right. So
even for myself, I didn't have the trigger needle for one. And you obviously, like it's very specific and I was
right.
freaking out about it. So
Right. So being able to, that's exactly. So, last night I got a text message from a patient asking a question like, I'm looking at the Lupron. Do I take both needles or one? That's,
right.
that takes me 4 seconds to answer, and it
Yeah.
reduces a huge amount of stress from the patient. So those are like easy, simple things that, she's
Mm.
there freaking out, and I can very quickly give a quick answer and just dispel that. So that's, core to who we are and what we do.
I love that one. It's a huge benefit and it's such a stressful process. Anything that we can do as professionals to reduce the stress is invaluable, I think.
Exactly. And that's hence white glove fertility.
Yeah. So I mean, who are your typical patients? Is it mostly IVF? Are you doing surrogacy, egg donation? Like what are the types of cases that you're seeing?
Yeah, I actually see a mix. So I
Hmm.
would say we've got, IVF patients, we've got just, initial infertility workup, so patients that are just having trouble getting pregnant. I also did a fellowship in reproductive genetics and recurrent
Hmm.
pregnancy loss. So I
Oh
see
wow.
a lot of patients with either rare genetic issues or recurrent implantation failure or recurrent pregnancy loss. We do
Hmm.
have, a number of patients with, same-sex couples. So we do a lot of,
Great.
we're doing a good portion of third party as well as,
Okay.
surrogacy gestational carriers. So really the gamut. And we
Yeah.
do egg freezing. So I see plenty of patients who are just here for fertility preservation.
And it's so interesting about your background with the genetic testing, because that's something that sometimes is not talked about or it's overlooked. And I think it's hugely important, especially if someone's having reoccurring loss. So I'm sure it helps with success and, with your patients.
Yeah, I mean, I guess the reason I even did the fellowship in the first place was because I felt that genetics was becoming such a critical component of our field. And
Hmm.
being able to understand that on a different level can just provide a lot of benefit to patients. So uh, I don't necessarily need a genetics counselor,
Right. Yeah.
to interpret the results for me. I know what those are. And the other thing that's beneficial is oftentimes patients have, most of the time when you do carrier screening, you come back with something positive. Well, I actually know what a lot of those disorders, not all of them, but a lot of the disorders are, and I may have actually treated them in the past.
Hmm.
So I've
Yeah.
seen kids with that disorder. So it helps add a different dimension in terms of counseling, and information flow to patients.
Yeah, I mean, the more you know, the better. It's best help your patients. I remember when I was starting this IVF process, not even surrogacy, but we did some kind of genetic testing through the Victor Center. It was called something
Yeah,
else then. And
yeah,
it was so helpful to know. And it's something I might not have known about, but for professionals being aware of this type of testing.
yeah. And it's become, it's become a critical component of what we do. So.
That's great. And so, where are most of your patients from? I mean, is it primarily in Miami where you're located, or do people come from all over?
So when so we opened up last year, and I thought we would be pretty hyper local, but we're not.
Okay.
It's I would say majority are South Florida. We have some Central Florida patients, and then we have
Okay.
some patients from New York. I have patients from other areas in the country, LA, for example. It just patients find me right now word of mouth. So
Okay.
hey, we really our friend went to you, said you were great and amazing, and they said I should go nowhere else. So I'm in LA, I'm in wherever, and I said, okay, no problem.
Awesome.
I have a few international patients, so we a little bit of everything.
Okay, great. Good to know that you can help remotely, to a degree with patients all over.
Yeah.
And so if you would just shed some light on what type of testing do you perform to screen a surrogate for an intended parent who might want to know what kind of medical testing is done when they're pursuing surrogacy?
Yeah, that's a great question. So, we follow ASRM, the American Society of Reproductive Medicine, their criteria. But essentially, what we're doing is we're trying to determine, and I tell all my patients this, when I'm talking to an intended parent, the most important thing is determining the ideal thing for the intended parent. When I'm meeting with the surrogate, it's making sure or the gestational carrier, is making sure that it's safe for her to
Of
also to
course.
pregnancy. So we do the standard infectious disease labs that's required by the FDA. We do what's called an FDA evaluation, which is basically a head to toe exam, looking at anything that can increase the risks of them having any infectious diseases. We do a full intake, a medical history, a family history, surgical history. We do ultrasounds. I also will do an office hysteroscopy typically at that first visit as well when I'm
Okay.
screening to look at the uterus. So I'm doing a 3D rendering of the uterus, make sure the outside of the uterus looks good. I do a hysteroscopy where I actually look at the inside of the uterus, make sure that there's nothing in there that would reduce her chances of being successful when an embryo is put back. The other thing I do is I talk to them, and I always like to talk to the couple. If it's a same-sex couple, I'll talk to the partner. If it's a heterosexual couple, I want to meet with whoever's living with them to get an idea, to get a feeling for who this patient is and whether it would be a good home, for the embryo. And I will tell you that that has result. I have rejected patients because of that, where
And I think that's great. I don't think anyone's benefited by a rubber stamp, for
no,
medical approval.
and I've even gone as far as called up the therapist that originally approved them and said, "Hey, I picked up on these things. Like these are concerning. Like I'm not approving them. You might want to talk to this couple again."
I love
Uh,
to hear that. I mean, the safeguards at the beginning are so critical to ensuring a smooth process. So the more vigilant someone can be to make sure, red flags are addressed, it just makes it better for everyone.
no, and I also talk to them. Part of the process is the both the intended parents and the surrogate need to go through psychological counseling, so they do some therapy. But I also talk to them about what has their experience been like in pregnancy. We'll review previous pregnancy records. Did you have vaginal deliveries? Did you have C-sections? Do you have complications during pregnancy? We're looking at all these things because we want to make sure it's safe for the intended for the carrier, but we also want to make sure that it's going to give the best chance for a healthy uh, child for the intended parents. So
I
it's
love it. Well, it
about
sounds like informed consent is one of your top priorities, so people
it is.
understand.
It
Yeah,
really is, and I will always talk to the patients about that as well, both the intended parents and the
yeah.
carriers, because I want to make sure that I don't do rubber stamps at the end of the day. So yes, you've had your therapy session. That's important. It needs to be done. It needs to be approved, but we still have to talk and I still have to be comfortable with this as well.
Oh, yeah. I mean, I love it. Those things should not be perfunctory. Like, they should be carefully analyzed. And I love that you brought up that you're concerned, obviously, about the success of the pregnancy, but the safety of the surrogate is so important and something that should never be overlooked. So it's like the whole package, I think, is really great to hear.
Yeah, 100%.
And so Florida law has a medical need requirement that the couple has difficulty gestating to term or there's a risk to the mother or the fetus. So I'm just curious, what are some of the reasons that you see medically that people come to you to pursue surrogacy in Florida?
Sure. Yeah, there's a number of them. It can be as interesting as they don't have a uterus. They're born without a uterus.
Yeah.
Something called MRKH, and they don't have a uterus. They have ovaries. They're able to produce, gametes, so eggs, and they can create embryos, but they wouldn't actually be able to carry. Um, you could have patients who have undergone hysterectomies for cancer or for other reasons where the uterus may have been removed.
Mm,
Other things that I'll see is severe diseases. So especially autoimmune diseases. I've had patients who
mm,
are transplant recipients. So, they're on very specific immunosuppressants that wouldn't be safe to stay on during pregnancy, but for us to stop their medication could be, critical. They could die from that. So there's a balance. We have, it
right.
wouldn't be a safe pregnancy. You can have severe heart disease as well. Other things that I've seen also is patients with recurrent pregnancy loss. So, eight, sometimes seven, eight miscarriages where we
Mm,
can't figure out why. They've done seven, eight transfers and it hasn't been successful. Uh,
wow.
those are, various reasons where it wouldn't be possible or it wouldn't be safe in order for the patient
Mm.
to
And this
conceive.
is why it's important you have those comfortable chairs in your office because the patients that are coming to you have been through a lot. As we
Yes.
were talking about before the show started, I mean, it's just this, I think people in this space are like in a very delicate place and it's hard. I mean, they're not there for the fun of it.
Yes. I mean, by the time they've reached my office, the amount of
Right.
stress and anxiety that they've experienced. So we try to do whatever we can here at White Glove Fertility to reduce that. I mean,
I love
like
that.
one of the things that I did is I chose these comfy, oversized, like, twisty chairs so
Yeah,
kind of sink into them and like just feel a little bit more relaxed when you're coming to sit and talk with me. And I see it work. I love it. I love seeing that stress when they walk in, they sit down, they twidge it, they fidget a little bit, and then they're like, okay, fine, I can talk.
I love it. You'll have to send us a picture of the chairs so we can include it in the show notes
Okay.
so that we can share
All
everyone
right.
how comfortable it is there.
I mean, one thing I do want to say is that like surrogacy is not a shortcut, right? And for many people, it is literally the safest or only path for them to have a biological child. It's definitely not a like, we'll just do that. The
Oh, yeah.
process is so complex, and it doesn't shorten the time to having a child. If anything, it triples or quadruples the amount of time it would take.
Time and money and
Yeah.
everything else. I love that. So that kind of leads me to some of my last questions is what would be some advice that you would give an intended parent specifically who's thinking about surrogacy from a medical perspective, just some things to keep in mind as they come to your office to talk about it?
Um, well, I would say the first thing is that this is a journey. It takes time, it takes patience, and it takes time again. It's not
Mm,
it's not straightforward. There's going to be a lot of twists and turns in the process, in the journey, and we're here to help reduce those as much as we can. I think
right.
it's really important that people have a good coordinator, so a surrogacy coordinator, a
Mm,
really good lawyer, so legal counsel in terms of understanding we're not going to go over the legal issues.
right.
Um, and having so those would say are some of the most important things at the get-go.
Yeah,
Uh,
like your team is in place, like a strong team.
yeah, I think those are in my experience, those are the issues that experience a lot of friction. So if you're trying to, if you don't have a coordinator, and then all the different very specific needs that are required for this this space, the pieces end up being missing and you didn't realize you needed that.
Mm.
And all of a
Yeah.
sudden you need this. And it can feel overwhelming because you didn't realize, like, okay, I need all these things. And I'll talk to patients about that. You need to have a therapist, you need to have a lawyer. I mean, it's really important that you have a lawyer and a contract and you
Right.
understand. It's really important that you talk to a therapist about what does it mean? Some of the questions the therapists are going to ask are things like, what are you going to tell your kid? Are you going to tell
Mm.
your kid?
Right.
Just thinking about that ahead of time is important. And you might process it in a way and say, well, I don't know if I can do this. And
Mm.
I'd rather you know that up front than start going through the process and then discover that later on. So
Great
those
advice.
are some of the things I would say. And then, the first surrogate that we screen may not be the one that makes it through. I mean,
Mm.
I know I know how much time and effort and money goes into just getting to that first one, but I put that always aside and I focus on, is this going to be the best option? I don't want to be like, I'm not a fan of that.
Right. Yeah. No, it's so great you're being so attentive with the attention to detail, and it's kind of like what we spoke about at the beginning with the white glove concept, like just the extreme communication really just makes everything work so much smoother. So I think that's great. And just kind of a end of interview question, what is the most rewarding part of your work with white glove fertility and being an RE?
The most rewarding part is when they come back with the baby. That's
Yeah.
and I love that when, or and for some of my patients that live out of town, they'll send us pictures.
So nice.
Seeing that, the second most rewarding part is graduation day when they can go when we graduate
Mm.
GYN.
Right.
But that's why we do this, helping people. And I think for me, it's when patients who never thought parenthood they could achieve parenthood, they
Mm.
finally hold their child. That's what gives me probably the most reward. And it's actually interesting when I was trying to decide what I wanted to do in medicine when I was in med school. What actually sealed the deal for me and what made me say 100% this is the right way. So I was a fourth year med student. I was between a couple of different things. I liked OBGYN, I liked fertility, I liked trauma surgery. I
Mm.
liked a lot of things.
Yeah.
I had a rotation. First patient I saw in my fertility rotation was actually a gestational carrier. And before we walked in the room, the doc pulled me aside and said, you're going to see three people in this room. You're going to see the husband, you're going to see the wife, and you're going to see a third person. And that's who we're doing the ultrasound on. And that is the sister. This woman was
Oh,
born
very
without a
cool.
uterus. Right. This woman was born without a uterus. She has MRKH. So her sister is carrying it. And I was like, that's really cool.
Yeah.
And we walk in, we do the ultrasound, we see the heartbeat, and I got emotional. I never met these people. And that's how I knew this was the field I wanted to go into. So it's actually
Wow.
interesting that was literally the moment, the aha moment.
That is a great story. Thank you for sharing that. It is such a beautiful process. And thank you for all the help you give patients that are going through this very hard time. It means so much to me as someone that's been through it and that's in this professionally, like to have doctors that care clearly so much is just amazing. So thank you.
Thank you. I appreciate it.
Yeah, and we'll be happy to share how to contact you if you, send us your information so that our listeners can speak to you about any issues that they have regarding third-party reproduction or general IVF. And I just thank you so much for your time and all your great commitment to this, to our journey, our surrogacy
Well,
journeys.
thank you. And I also want to, put that back to you in some way that, this is part of what you do. I mean, you've put a tremendous amount of time. Just the fact that you were even at the event that we met at, this
Thank
just
you.
shows how much you care about your clients, not slash patients. Uh,
Thank you.
that this is something that you spend the time, you do these podcasts, you put as much information out there to help as many people as possible, and I commend you for that.
Thank you. I appreciate that. When you feel passionate about something, it's, you want to do as much as you can to help others. So, well, thank you for your time, and we look forward to sharing our interview with our listeners today.
Okay, awesome. Thank you so
Take
much.
care. Thank you.